That important GMA health alert about high blood pressure. The American Heart Association changing the guidelines, meaning almost half of American adults could now be living with what's called the silent killer. This affects men and women, and our chief medical contributor, Dr. Ashton, is here to talk about that. And you checked with Jen, right? Jennifer, you checked Jennifer's numbers?
I checked Jennifer's numbers. She gave me permission to share them. It was a little bit high. We did check it twice.
Well, she's on national TV
that's right.
under the lights.
We're going to cut her some slack. Her heart rate was a little high elevated also, but it was 154 over 100, Jen. So we did suggest that she get it checked again. But, Robin, this is medical news that could potentially affect
what do we need to know here?
Half the country. New guidelines. The old guidelines, if you had a number of 140 over 90, you were classified as having hypertension. Now that number is dropped to 130 over 80, reflecting the fact that we know damage can occur at those lower numbers. So again, very important for people to know these numbers, and it will affect a lot more people. It will double the number of women under the age of 45 who meet criteria for having hypertension. A lot more people involved.
Will this be a lot more people on medication?
Actually, it won't.
No?
The key here is that this should be managed with lifestyle modification. It's only expected to increase the number of people on medication by 2%, but you have to take a look at these changes because these can make a big difference. Eating the right diet, the DASH diet, is the gold standard in lowering blood pressure. Fitness, both cardio and weights, lowering sodium in your diet and increasing potassium in your foods with things like avocados, bananas, and salmon, and limiting alcohol, no more than 2 drinks a day for men, 1 for women. They can lower those numbers by anywhere from 4 to 11 points, and every point matters.
And you want to show us what high blood pressure does to the body.
Right. Now, listen, I think we hear it as the silent killer. You have to understand that high blood pressure affects organs like the kidneys, the eyes, the heart, the blood vessels. But I want you to just look at this demonstration. If you imagine this pump as the heart and this as your blood vessels, your vascular system, with normal blood pressure, it's very easy for the heart to pump. It can pump that blood all over the body. Once you have high blood pressure, you have increased resistance in these blood vessels. That pump has to work harder to circulate the blood, and over time, this does major damage.
So what should people do right now?
I think the key thing is you need to know your numbers. And we've heard about white coat hypertension. People go to the doctor, their blood pressure gets elevated. For Jen, it's just being here. But get one of these home kits, check your blood pressure at home, make sure that you're trying to do it on a bare arm. And if you have larger arms, you need to use a larger cuff.
Good. All good advice there. All right, Jen, thanks very much. Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.